Avoiding disaster, 9 critical tummy tuck questions. Did you know that 40% of tummy tuck patients report their surgeon never discussed potential complications before surgery? This alarming statistic reveals why so many people end up with unexpected outcomes and additional surgeries. I'm Dr. Tim, and after performing over 1,000 abdominoplasties, I've identified 9 critical questions that separate excellent surgeons from mediocre ones. The 6th question might be the most important one you'll ever ask your surgeon. Coming up in this video, you'll learn the one question that reveals your surgeon's true experience and why a perfect record might actually be a red flag. How to avoid botched results by asking about incision planning and muscle repair. Why surgical facility standards matter more than you think, and how to verify them. How to avoid the revision trap that costs patients thousands in unexpected expenses. Stick around, these questions could be the difference between a smooth recovery and a surgical disaster. The 2 a.m. panic call. Let's start with a real-world example. Imagine it's 2 a.m., you've just had a tummy tuck, and you wake up in a panic. There's unexpected swelling, sharp pain, and a feeling that something is very wrong. You reach for your phone, but you're not sure if this is a normal part of recovery or an emergency. This is the nightmare scenario every patient hopes to avoid, and the reason why asking the right questions before surgery is so critical. So let's break down the 9 questions every tummy tuck patient should ask and why they matter. Point 1. The hidden dangers of surgical experience. First, let's talk about experience and why a perfect record might actually be a red flag. Every legitimate surgeon who performs a significant number of tummy tucks has encountered complications. It's not a question of if, but when and how they handle them. Ask your surgeon, what is your complication rate for abdominoplasty? If they claim 0 complications, ask how many procedures they perform. Fewer than 100 procedures might explain this, but it also means less experience with challenging cases. What are the 3 most common complications you've seen in your practice, and how do you manage them? A qualified surgeon should be able to discuss seroma formation, delayed healing, and other common issues without hesitation. How many abdominoplasties do you perform each month? Surgeons performing fewer than 4 to 5 monthly may lack the volume necessary to maintain peak skill levels. How do you handle complications if they arise? Listen carefully to their response. Some surgeons charge additional fees for managing complications, while others include this care in their surgical fee. How accessible are you for post-op concerns? Ask about their after-hour contact protocol. The best surgeons ensure you have direct access to medical support if you experience issues after surgery. Point 2. Critical decisions about your body. Next, let's talk about incision placement, one of the most important and often overlooked aspects of tummy tuck planning. Ask, will you show me exactly where my incision will be placed? A good surgeon should mark this on your body while you're standing, taking into account your unique anatomy. Also ask, will you repair my abdominal muscles during surgery? Proper muscle repair is essential for patients who have experienced pregnancy or significant weight loss. Without it, your results may be short-lived. Point 3, safety standards and handling complications. Now let's talk about where your surgery will actually take place, because even the best surgeon needs the right facility. Ask, is your surgical facility accredited, and if so, by which organization? Properly accredited facilities have strict safety standards, including emergency equipment and trained staff. Then follow up with, what emergency equipment do you have on site, and are your staff certified? These questions can literally be life-saving if something goes wrong during a surgery. Finally ask, what is your policy for managing complications after surgery? Some surgeons charge extra for complication management, while others include this care in their surgical fee. You now know the 9 critical questions that separate excellent surgeons from mediocre ones. But asking the right questions is only half the battle. You also need to understand what you're actually paying for. In my next video, I break down the real costs of tummy tuck surgery, not just the surgeon's fee, but the hidden expenses that catch patients off guard and how to make sure you're getting genuine value from your investment. Because the wrong financial decision could cost you thousands in revision surgeries later. Click here to watch Is Your Tummy Tuck Worth the Price? And make sure your investment pays off.